What we found was that when we divided the patients up into 3 groups, there was a group of patients who were alive after 12 weeks from their initial palliative care referral. There was a group of patients who were lost to follow-up, and predominantly it was because they'd become too ill and were no longer coming to the cancer center for treatment, and a group of patients who had deceased. So when we looked at things that predicted who those different groups were, the things that stood out was first their performance status at the time of their initial palliative care referral. And it wasn't quite as obvious as you would think. So the first one was that if they were alive if they were in the alive at 12-week group, they had the best performance status at the time of palliative care referral, which isn't a big surprise. The other finding that was reassuring was that if they had a shorter time since their initial diagnosis to the time of palliative care referral, they were more likely to be in the alive group after 12 weeks. The group that was most likely to be lost to follow-up after 12 weeks was the group with the lowest performance status. So if they had low performance status at the time of palliative care referral, they were more likely to become ill and no longer be coming to the cancer center. This group was also more likely to have longer time since their initial diagnosis until their palliative care referral. And then this one was a little bit confusing. The middle group, who had middle performance status, they weren't the best, but they weren't the worst. This was the group that actually was most likely to be deceased by 12 weeks. So that, I think, needs more research and sort of more understanding of what's going on there.